major illness people are actually facing now is has to do with illnesses arising from stress, such as hypertension, which leads to high blood pressure and things like that.
To make the health better in Nigeria, I think let's make the health centers very close to each location.
The one thing I think that the government should do to make healthcare better in Nigeria is to, prioritize healthcare in Nigeria.
Hello everyone, my name is Loretta Ngwebe Sibyl, and I am here on the street today because it is World Health Day, celebrated 7th of April around the world. This is a day dedicated to raising awareness about health, and that good health is not a privilege. It is a right that every single person deserves. I am here as a grassroots development champion under good health and well-being to ask people what health means to them. So let's get into it.
Well, presently in our community, and let me say, as well as Nigeria as a country as a whole, the major illness people are actually facing now is has to do with illnesses arising from stress, such as hypertension, which leads to high blood pressure and things like that. And of course, as a matter of fact, you know that such illness is we can rank it to be very major in our society today, because most of the time you hear people slump and die and all the rest. It's not because maybe they have terminal illness in them before, but most of the time it's as a result of high blood pressure, stress. When your stress level is high, definitely it will impact on your pressure, on your blood pressure. And of course, you know what it means if one is having high blood pressure that is not actually being attended to. Most people have high blood pressure because of this stress level I'm talking about, and some know, some do not know. And even those that know, sometimes they find it difficult in reaching out for help in terms of being able to afford the drugs that can take down the pressure. And apart from that, we also have terminal illnesses that are very common these days, such as diabetes, resulting from high blood sugar and all the rest. So those are just the illnesses I feel are major in our country today, that is impacting on people's life, and it's really, really negatively, and it's really very, very rampant in our country today. Well, affordability is for government to be able to provide an affordable environment where people can afford to have health care. If possible, at least make health care free. Let it be affordable to everybody. If government can make health care affordable for people, in fact, in most cases, they could even make it free. Let it be a kind of a social social service that federal government will provide for the people, because it's not everybody that can afford health care. That is the truth. It's very expensive, at least to treat oneself these days. Very, very expensive.
When we talk about my health, sometimes I have an health issue which I ignore it based on no time. Not that I'm afraid going to the hospital, but I'm a little bit choked up with my work. When I take the time, let's say you come out in the morning, your office, I say, okay, in the next 30 minutes, let me round up and go to the clinic. Before you know it, you'll be choked up with some work in your own office. So I will just ignore it and maybe take one analgesic to relieve the pain and continue my work. One of the things that we need to do in Nigeria to make the health better in Nigeria, I think let's make the health centers very close to each location. Let's say I'm here in Otako, we're supposed to have a health center in Otako here. at least a government hospital, not private. Majority of the hospitals we have in Nigeria here are private, which are more expensive for people to afford. So if we can make our hospitals, our health centers in each location, because I see some people from living in, let's say, in Otako here, going to Gwagwalada, or going to, when you go to FMC here in Jabi, you see crowd there, you can't be able to wait. So if we can make it available for Nigerians to just take your time, use your 30 minutes, 1 hour, and enter the clinic and they attend to you, than going to a far distance where when you go there, the crowd will be much, and you continue waiting. Go to some of the government hospitals, you wait and wait and wait 1 month, they have not attended to you. I think we can make most of our health centers close by, and not make it in a number that everybody can go to, run and just enter and be attended to. I think the health sector in Nigeria will be more better.
I think a lot of people don't take their health seriously because there are a lot of factors. But the major reason, I think it's due to economic reasons. So when people, after noticing some health issues in their body, they would find it difficult to access good medical care because of the financial burden on accessing such medical care, especially in Nigeria here. So a lot of people would rather go and seek alternative ways of taking care of their health, like going to a chemist to get any medication, which they know is not actually what they need, but because of the lack of money that I mentioned, they would rather do those things than go to a proper place and get proper medical care. So I think that's the major reason, and I think a lot of people don't do that because of lack of money. Okay, the one thing I think that the government should do, right, to make healthcare better in Nigeria is to, prioritize healthcare in Nigeria. The aspect of paying the healthcare workers more, paying them better, so that young healthcare workers, doctors, nurses, and paramedics will not be looking at leaving the country anytime they secure their licenses to go earn better outside Nigeria. And when we have enough manpower in terms of doctors, nurses, and of course with proper equipment in the hospitals and in the clinics around, I think healthcare will be far better. But if the government can prioritize paying doctors, nurses, and paramedics better, at least we have manpower first before we talk about equipping the hospitals around with the right instruments and equipment they need to offer standard healthcare services.
And that is it. Real people, real answers, and this is exactly why World Health Day matters. I want you all to learn about your health and also talk about it. Happy World Health Day, everyone.